Hi guys, welcome back. In this video we shall be talking about the kidney disease. What are the symptoms of kidney disease? How can you prevent a kidney disease? What are the simple tests that you can do in order to know the functioning of the kidney? Let me tell you guys, kidney and liver are these two organs which will have symptoms to a very late stage. This means your kidney or your liver has to be damaged to a very great extent, and then you're going to actually see any kind of symptoms. Just to give you a perspective, we are having two kidneys. Out of these two kidneys, even if just one is 100% damaged and the remaining one is damaged up to around 75%, then and only you're going to see any sort of kidney damage symptoms, right? So you are not supposed to wait for the kidney damage symptoms and then you're going to take action. This means you have damaged your kidney to a very great extent, right? So it is not that you're going to watch out for these symptoms. So you have to do some periodic medical examination in order to find out what are the symptoms of kidney damage, right, or the signs of kidney damage, right? So please try to understand what are the symptoms. I'll tell you. Symptoms of this is very typical. Is you'll be having edema around your eye. You will be having edema over around down of your eyelid. Okay, this is your puffiness. You'll be what you can see what is puffiness, right? It's like swelled. It will be like swollen up, right? Then you'll be having a swelling of your ankle or your leg, lower feet. You'll be having swelling there. Why? Because there is edema. Why is this edema? I'll tell you by an example. Imagine this is your blood vessel, right? This is your blood vessels. This is a blood vessel. Inside this blood there is blood, obviously, right? So there is multiple number of holes here. Multiple number of holes are there in this blood vessel. The blood that is traveling from here comes out here. It does not leak out here since it is having holes. Still, even though it's not leaking out, because there is a component that is present that is known as oncotic pressure. This has been attained by the protein. So this protein is making sure the fluids not to leak out. Now in kidney disease, what happens is that your kidney is not able to filter out the protein, so it is allowing the protein to get lost in the urine. So you are having less amount of protein in your body. So less amount of protein means less oncotic pressure. Loss oncotic pressure means the blood, the fluids will leak out of the blood vessel. That is the reason you will be able to see edema in your eyelids. The fluid will leak out of the blood vessel but will remain in between the cells, not inside the cell, between the cells, right? Again, same goes with your leg. And as I told you, there will be urine. You'll be having protein in the urine. So what will you see whenever you pass your urine in the washroom? You will be able to see a lot of frothy urine. This means a lot of foamy urine. Just to give an example, whenever you make an omelette, you make an egg, you break the egg, you put it in the utensil, and then you you stir it, right? So you can see a lot of bubble formation. That is actually due to albumin. So the white part of the urine is containing albumin, so you are able to see foamy. So that kind of things will occur whenever you pass your urine in the washroom. And whenever you try to flush it, you need to flush it 2-3 times in order to make sure the foamy, the frothy is released. So if these things are there, please immediately go and get it checked. The third thing that will be there is that you will be generally tired. You will be weak. You will be feeling tiredness. You will not be feeling good energy, because your kidneys are responsible for production of RBC, right? You might be having anemia also. Next thing that might be there, you will be having itchiness. You will be having itchiness in your body. The next thing you will be having is what you will be having very typical is actually you will be having very susceptible for the infections, because your proteins are connected to the antibodies. So if your urine is releasing protein, so it will also pull out the antibodies out of your body. So it is very important, right? So your immune system will go down. Along with this, you will be tired, you might be having pain, you might not be able to eat, you will be having fever, you might be having general weakness, your urine frequency might change, it might either increase, it might either decrease, you might be able to see blood in your urine color might be very very unclear. It might be very unclear, right? It will be like whitish unclear. It might have a very bad kind of smell. Or you might be able to see you're having difficulty in urgency. That means you feel like you urinate and you immediately need to rush to the urinal. Or you might say that I may just pass out in my pant, right? This is known as urgency. Or you're having difficulty in initiating the urine. You need to apply a lot of force in order to initiate the urine. Or what you can be having is that passing urine to a very less extent. It's very dark. This means you are not drinking enough water, right? So these are the symptoms that you know you're having kidney disease. Now, once we know the symptoms, now let us try to understand what are the causes of kidney disease in the first place. And one of the main two causes, the two main causes, if you make the list of entire kidney disease causes, the main two causes actually your diabetes and hypertension. If you are having hypertension, it is not uncontrolled, it is uncontrolled hypertension. You know the kidney is made up of nephrons, and nephrons are made up of small net fibers. This actually allow the water to filter through it and not allow the proteins to filter through it. If there is high blood pressure, there is constant pressure in these filters nets, so this the hole between the net, right, it increases, so you are able to lose the protein there. So high blood pressure will cause the holes to become bigger, right? Second thing is that if you're having diabetes mellitus, it can cause you diabetic nephropathy. Same, if you're having uncontrolled diabetes, you will be damaging your kidneys. So main two factors is uncontrolled diabetes mellitus and uncontrolled hypertension. Yes, there are some other causes as well. If you are having autoimmune disorders, it means the immune system is producing antibodies against your kidneys. Example, if you are having SLE, very seen in females, and it is one of the one variant of SLE is actually lupus nephritis, and if you're having that, your kidney has been damaged. Second thing is that if you're having certain kind of infection in your kidneys, or the third thing can be any kind of trauma to your kidneys, you will be having all these effects. But main two factors is actually your uncontrolled diabetes mellitus and uncontrolled hypertension, right? So these are the main two things that you should be watching out. And also certain kind of medication and certain kind of herbal medication as well. If you are taking herbal medication thinking it is having no side effects, let me tell you guys, there is no medicine in the world that is having no side effects. Technically there is no side effects. Yes, now you might say multivitamin doesn't have side effects. Multivitamin is not a medication, it is a health supplement, right? Everything is a poison if you take in wrong dosing. Even your water is poison if you take in very high amount of water in very less amount of time. You can even die, right? So please do not think that natural medications will not have any sort of side effects. So please, whenever you're taking any sort of medication or you're doing any sort of self medication, you should go and meet your doctor, because any medication that is given by your doctor, he or she is always judging that the side effects and the benefits are high, that's why I'll give you the medication. If the side effects are high, I will not give you the medication, I'll go for an alternative, right? So now you know what is the causes, you know what are the symptoms. Hey, do not worry about the symptoms, okay? You do not need to see for the symptoms. If you're waiting for the symptoms to arrive, I don't know, man, what to say. Do not worry about the symptoms, man. You will be damaging your kidney to a very great extent. So what are the tests that you can do that in order to find out that your kidneys are working perfectly fine? See, first thing, as I told you, please try to find out that you're not having hypertension, right? If you're having hypertension, take the medication very properly, right? Because maximum people who are having hypertension, they do not know that they are having hypertension. Or sometimes some people know that they are having hypertension. Around 50% of people do not take the medication. Even if the 50% people are taking medication, around 50% of medication are not working perfectly fine. They're not taking a good dose, not taking a good pattern how the doctor have been advised. So it is very important. So go and check your blood pressure regularly in order to find out that you're not having hypertension. If you're having hypertension, taking the medication, still go and check your blood pressure level to find out your blood pressure level is under normal. Second thing, go and check your diabetes mellitus. Are you having high blood sugar in your blood level? If you're having this, you have to start off with the medication. After taking the medication, again do the test in order to find the medication is working perfectly fine or not. The third thing is that you have to do a blood test that is on a serum creatinine level. In males, it is around, upper limit is around 1.2 to 1.5, but it's around 1.2. Female is around 1.0, so it's around 1. But you have to see the values that is present in the specific lab that you are doing the test, because all the labs will be having certain up and down because of the machines they're using, the sensitivity of the machines, the reagents they're using, the techniques they're using. So what I want to say is that measure with the reference value of the lab, right? Second thing that you have to do test in your urine is something known as your protein. If you are, as I told you, wait, I'll tell you how what is happening. This thing. Okay, leave it. You are having something known as dipstick. There's something known as dipstick. You just put it in the urine, and you can able to see how much amount of protein is there in your urine. You should not be having protein in your urine. You should be having very minimal. This means your dipstick is not able to catch it also. So if you're losing albumin, this means you're having certain kind of problem in your kidney. The next thing that you have to do is that you have to do your urine albumin creatinine ratio. It's very important. Urine albumin creatinine ratio in your urine, you have to do that. And the second one is the serum creatinine ratio. These two things are very very vital. You just do this test, you get the value, and just put the value on the online internet. You just type, okay, what is my go in your website, and just type any website, just type, okay, GFR calculator. In that GFR calculator, you put your creatinine level, you put your age, you put your height, you put your ethnicity. It will tell you what is your GFR level. Your GFR level should be coming around 90 or more than 90. This means your your kidney is working perfectly fine. And you also need to see the ratio, urine albumin creatinine ratio. These are the two tests. It's very very vital for your kidney function. In order to know these two tests will tell you that your kidney is working perfectly fine or not. You will be able to catch hold of the kidney disease in the first place in very early stage. The earlier you do, the better outcome is it, right? So that is the reason, guys, do this test. Even if you are not having any symptoms, you are perfectly fine. You should do it at least once a year. It's not expensive. It's not very expensive, guys. You should do it at least once a year. This to test. And your diabetes and hypertension. That means you have to check your blood pressure level, your diabetes, your serum creatinine, and urine albumin creatinine ratio. This four test you have to do in your every yearly. So this will help you to prevent certain complication to arise. And also, if you're having diabetes mellitus, yes, go and get your eye checked every yearly by your ophthalmologist. So these are the things that I wanted to tell you, guys. Let's try to understand. Kidney disease is a very very severe disease. You cannot think of that, okay, I'll go for a transplant. It's not so easy to do transplant. It's very expensive. First thing, you have to get a legal donor. Third thing is that even if you get a donor, your body might reject the kidney. Even if your body is not rejecting your kidney, you have to take lifelong immunosuppressive drugs in order to keep your immune system less in order, so your body doesn't kick out the kidney that you have got from your donor. So these are the things that you should be very careful. So do not think kidney thing is very easy, or doing a dialysis is very easy. It's very painful and very expensive. You have to do, in the average, you have to do, sometimes you might need to do 4 or 5 times in a week, or sometimes generally you need to do around 2-3 times in a week. It is very painful. It is, you have to stay, you might be having, you have to produce a fistula, you will be having infection, you will be having pain, you will be depressed. So it is not easy, guys. So that is the reason, please try to catch off the kidney disease as fast as possible. Try to make sure that you're not having diabetes mellitus, and even if you're having, try to control it very properly, and your hypertension, control it very properly, and try to avoid it. And do your serum creatinine level, and you do urine albumin creatinine ratio in your urine. So if you do these things, I'm very sure that you will be having a very good chance in avoiding the kidney disease. Or even if you're having kidney disease, you will be able to treat and take action and have a very good outcome in a very better way. So as we say, the more faster you catch the disease earlier, the more better is the outcome. So that's all for now, guys. Thank you for watching, and I'll see you in the next video. Thank you.